Well, we talk about Hollywood and all these Hollywood stars. How would you like to have a smile that's starlight? All right, let's talk about it right now. Joining me right now is Dr. John Heimke, who's an amazing dentist and an amazing snappy dresser, as always.
Thank you.
Doctor, it is great to have you here. We're going to talk about the smile makeover and what it means. What's the most common questions that are asked of you? I'm sure the first one is, how long do I take to get from this to that? That's probably question number one.
Yeah, you know, it usually takes about 3 appointments for each arch or each jaw.
Okay.
And we do it usually in a linear fashion. So we'll do the top, get it all done, and then we jump down to the bottom. We could do it as short as 2 days later, or a week later, or 6 months later.
All right, so how many teeth do you recommend for a smile enhancement, as you call it?
Typically, to do a smile, we want to do 10 teeth on the top, because when you smile, you show usually 10 teeth.
Right.
Some people, you know, that have a really broad smile, we got to do 12, and then 8 on the bottom. The big reason is when we smile, we show our top teeth.
Right.
But when we talk, as I'm doing now, obviously, we show our bottom teeth.
Ah.
So that's something a lot of people don't notice.
Well,
and if you have nice white teeth on the top and you have your normal kind of yellowy teeth that most people have on the bottom, there's going to be a difference. So usually you want to do both.
I think, Doctor, too, a lot of people have trained themselves not to smile as broad as they probably could because they've been embarrassed or somewhat ashamed of their smile itself.
They try to couch it, you know, hide it behind people.
No, it's true.
Yeah, yeah.
And a lot of people do the old hand thing, you know, where they'll say, you know, and they'll just kind of downplay their smile. Exactly. All right, so let's talk about this then. What happens when a patient comes to you and says, all right, now I would love to have a Julia Roberts smile, a big, broad smile. Do you say, all right, well, your face is not really designed for that? I mean, do you let them know the limitations and the advancements that you could make?
Exactly. Well, it's all customized. The smile is customized to that particular person. So if I'm looking at your face, I'm going to use your facial characteristics, and I'm going to use all those little inputs and design the smile just for you. So it's a better smile of you. You don't have this other person's smile in your mouth.
So it's not like just I want that one and then go. You know,
it doesn't work like that.
Okay, let's talk about the aging smile because, you know, I hate to say it, we're all getting older, but our smiles change as we age too, correct?
Exactly. We all age, our body ages, and our teeth age in the same way. In fact, what happens is our teeth become more yellow. They actually, the teeth actually narrow and get a little more crowded and go in as we age. Okay, and then the big thing is we lose muscle tone in our face. And so what happens is as we age, the lip gets longer. So when you were 20 and you might have showed most of your front teeth, now you only show half or less, then we have to help that out.
Okay.
And then on the lower, what happens is gravity kind of pulls that lower lip, unfortunately.
Right.
And then we show more of them. So usually if you have crowded teeth or something, it's nice to get those done. So we have the color matching and also everything's nice and straight.
But we're happier when we get older, right? So there it is. So we have a more reason to smile when we do get older.
Yeah, and then when you do the teeth and you build out that smile on the sides, it's like a little mini facelift. We call it a smile lift.
Right.
You know, except you're not getting cut on your skin. You're just getting some veneers that are pulling your smile out.
Let's talk about veneers too, because you brought them up here. Let's say if we want to get veneers on top.
Yeah.
Do we always get veneers on the bottom? Is it kind of like a, you know, yin and yang kind of thing? Is that how it works?
Well, like I said, if you're keeping about the same color, you don't necessarily have to.
Right.
But if you, you know, want to have everything match and maybe straighten everything out, it's a good idea to at least have a phase 1, which is the top, and then a phase 2 on the bottom as at least a goal to shoot by. But a lot of people these days are just saying, look, I don't have a lot of time. I just want to get it all done because, you know, people like coming to our office. But no matter what, when you go to the dentist, a lot of people go, I really don't know if I'm as comfortable.
Well, we want to see some before and afters because it's always great. Yeah. Okay.
So this is Michelle here, and you can see she had some challenges. She had some rotated front teeth, and you know, look at her eyes. She wasn't all happy. And then we did this case 16 years ago. 16 years ago. And Michelle is actually my hygienist. So she's, you know, she treats and cleans the teeth for the patients, and she is so happy.
So that smile is going to greet you when we come to see you.
You can actually see in real life what it's like. You can see my mouth. I have 22 veneers in my mouth. And this patient, you can see he's had some challenges with his teeth. And so we did exactly what I said. We did, in fact, we did 12 teeth on him on the top, and we did 10 teeth on the bottom.
Awesome.
And, you know, obviously you can see the results.
Well, if you want to see the results too, I'm going to give you all the information right now. Oral Design Cleveland. It's located at Center Ridge Road in Rocky River, 21851 Center Ridge Road, Suite 302, so you're on the 3rd floor. And then the number is 888-255-3588. Everyonelovesmysmile.com. Great website. And dental implants, RockyRiver.com. Doctor, as always, thank you so much for brightening up our stage and our set here. And thanks for bringing your smile.
Wonderful to be here.
I appreciate it very much. All right, coming up on the show, we go from teeth to feet. Yes, we're going to talk about good feet and making you feel better about your arches. There are 4 of them. We'll tell you more about that. Right now, let's take a look outside. It is warming up a little bit here. But the good news is we're going to be in the 70s by the end of the weekend. Welcome to Northeast Ohio, where it's always sunny, sooner or later. We'll be right back.
This segment of Good Company was sponsored by Oral Design Cleveland.